Fascinating thing about pain is that it can come from many sources. It could be from a trauma, it could be from a potential pathology that's happening within someone's body. It's also very, very subjective to that person involved. It could be mental, emotional in root. It could just be physical in root. There could be other sources where the pain is coming from, and that's why I find it fascinating. Pain basically tells you that there's something happening to your body that's potentially negative. It could be from an injury, it could be something pathological that's happening in your body, and it's telling you, the signals are telling you that you have to get this checked just to make sure that everything is okay. It's subjective with everyone. You can have two people with the same injuries or similar injuries, but one might react differently to the other. One might say it's very excruciating, another person might say, well, it's not so bad. Maybe 50, 60 years ago, it would have been factory work that would be causing people's injuries. These days, it's a lot of white-collar type of jobs, for example, typing on the computer, being at your desks. Over time, what will happen is people will start getting neck and shoulder pain, lower back pain, hip pain, etc. I believe there is. I think pain can be exacerbated by stress and anxiety. So some people come to me and there's a pattern where they start feeling shoulder or neck pain when they're very, very stressed or when they're very, very anxious. Some might say they get migraines or headaches. Some might get hip pain. There might be a whole load of other symptoms a person might have that indicates that they're probably under a lot of stress. Well, massage and acupuncture, they both have a calming effect on people. With massage, it can help relax the muscles, it can relax tight tissues, not necessarily just muscles, maybe connective tissue. Acupuncture has a deeper way of getting into a person in regards to getting them more relaxed. If you can cut off the anxiety and stress cycle is what I call it, because when you're in pain, what will happen is you become more anxious, more stressed. When you become more anxious and more stressed, the pain increases. So as a therapist, my way of treating that individual is to try to cut it off, cut that cycle off. Well, in regards to pain meds, one of the things that I, as a therapist, have to be aware of is that the person's sense, their sensation might be slightly off, or maybe very, very off in regards to giving me proper feedback. So generally, if I'm working on an area and it may be painful, that person on the table may not necessarily feel it as pain. So for me, I might work into that area and do more harm than good when the person can't give me proper feedback. So that's one thing that I always tell patients is to be aware of when I'm treating them, is that if they are on pain medications, I have to adjust the way I treat. And I'm not saying stay away from pain medications because I can't do that. What they need to do is they need to talk to their doctors and tell them that I am working with a massage therapist. Is it okay for me to get treatment, or is there any adjustment that he has to make? If you're suffering from pain, I think the best advice I can give you is to go visit a professional. The one key thing is prevention. So if you can prevent something from getting worse, it's always a good idea. So generally what happens is somebody comes in for treatment, maybe a row of 4 or 5, whatever amount of treatments they come in for a particular injury in our clinic. And eventually what happens is the patient comes in for preventative maintenance, so once a month or so, just to make sure that the muscles stay nice and supple. The more supple the muscles, I think in the long term, the better you're off, because the tighter the muscles, there's potentially a problem in regards to potential injuries that will happen over. I've got many funny injury stories. For some reason, I get myself hurt in the weirdest ways possible. So I'm going to tell you two. The first one is I've cut my thumb shaving once. I don't have hair on my thumbs, but what happened was basically I was trying to scrape off the the hairs off the razor, and I actually cut it. So I wore a Band-Aid. My friends at school asked me, so what's happening? Why do you have a Band-Aid on your thumb? And I told them I cut my thumb shaving. They all laughed. The second story is basically I was at a family picnic, and my brothers can tell you this, my relatives who were there witnessed this. I was climbing a tree, hanging off a tree branch, showing off. This is when I was in my teens, maybe early 20s or so. So I was hanging off a tree branch pretending I was Spider-Man. All of a sudden, I heard crack, a slow crack. All of a sudden, all I can remember was I landed on my bottom, flat. There was laughter. I looked up. I was in so much pain, but of course, I didn't want to show it. I was more embarrassed than anything. Those are just two of my injury stories.